these initiatives and the others that I've highlighted today, I maintain that the government is making progress regarding a goodly number of these matters and that the members of this House should vote against the opposition motion. Thank you, Mr. Speaker.
Questions and comments. Commentaire, the honourable member for Vancouver Kingsway.
Thank you, Mr. Speaker. Well, here's what is concretely established by every single researcher and healthcare professional in the country that study this issue. We know that there's 7 million Canadians who have no pharmaceutical coverage whatsoever today. That means that waking up in this country right now, someone will need medicine that can't get it. Second, what we know from a source as credible as a parliamentary budget officer who used extremely conservative assumptions, who didn't actually even account for all of the cost savings measures and used the Quebec formulary, the broadest formulary in this country, and found that if we had a national pharmacare system, we would save billions of dollars. Now, that's not surprising because that's consistent with every single peer-reviewed academic study. We know that with universal pharmacare, we can cover every Canadian and save billions of dollars. So I would ask this minister, as health minister, as someone charged with the responsibility of making sure that Canadians are healthy in this country, what possible reason would there be for not agreeing with the NDP motion to at least start a discussion with the provinces in the next year to begin the process of implementing universal pharmacare? Is she opposed to universal pharmacare, or is she simply opposed to action?
The Honourable Minister of Health.
Thank you very much, Mr. Speaker. And first of all, I'd like to thank the member for Vancouver Kingsway for his continued work and also his great work on the Health Committee. First and foremost, Mr. Speaker, we certainly recognize that Canadians are paying too much for drugs. That is absolutely, I think we all agree on both sides of this House that that is certainly a priority that we need to address. But I think what we certainly also need to address, we need to look at the issue of affordability and accessibility of drugs within this country. And our government is taking that work very, very seriously. Yesterday, I was very pleased that I received my mandate letter from our Prime Minister. And in my mandate letter that I've received, I simply want to read a quote from the letter, a part of the letter, that specifically speaks to exactly this. And first of all, it puts that he wants to continue to work with provinces and territories to advance the pan-Canadian collaboration on health innovation, to encourage the adoption of digital health technology, to improve access, to increase efficiencies, and to improve outcomes for patients. And also, I quote, to improve access to necessary prescription medication. This will include joining with provincial and territorial governments to negotiate common drug prices, reducing the cost Canadian governments pay for these drugs, and making them more affordable for Canadians, and exploring the need for a national formula. Mr. Speaker, I will continue as Health Minister to work very hard to ensure that we address these needs.